Okay, so the liver plays a huge role in maintaining homeostasis, right? You have the Kupffer cells, you have hepatocytes, you have a lot of specialized cells in the liver that take blood from the digestive tract, and what they do is they detoxify the blood. They get rid of all of the elements that we don't need. They break down the metabolites of protein. They put to work the breakdown of carbohydrates, which eventually is glucose. It does a lot of stuff, okay? And so the liver's whole job is to detoxify the blood from the elements that your body does not need. It breaks them down, it sends them to the bloodstream, then the kidneys pee them out. Your liver is also really important because it uses the elements of diet, like the amino acids found in your proteins, to synthesize or form other types of proteins like albumin or like globulin. Albumin is a protein that dictates water distribution throughout your fluids. That's pimps and harlots for those of you that know. You also have globulin, which is utilized with your white blood cells for antibodies and stuff like that, right? You also have proteins or amino acids that are utilized to create clotting factors. This is what gives a patient all of their signs and symptoms when they have liver issues like bleeding because there's not clotting factors. You have potential for infections because you don't have the antibodies to create. You have malnutrition because you're not storing elements of diet and things like that, folks, okay? So as the liver fails, the blood backs up into the hepatic portal vein. This is a big problem because the hepatic portal vein gets congested. This causes hepatic portal hypertension, which backs up into the GI system. It causes esophageal varices and a whole host of other issues, right? So that's what's happening when the liver begins to fail. It's important for students to know that the dietary modifications are really important because you don't want them to consume things like proteins or things that have fats because the liver right now cannot break them down how they're supposed to. Talking about fats, not fats, but talking about the liver, your bile that your liver produces actually has a lot of waste products inside, including the byproduct, the breakdown of bilirubin. And bilirubin is what gives your poop its beautiful brown color. So when patients have like pale white stools, that means there's something wrong with their liver. They're not creating bile, or that means that something's obstructing the outflow of bile from the gallbladder to the intestine. So just keep that in mind, okay? As this pressure builds up in the hepatic portal vein, plasma escapes. You develop ascites. You develop a collection of fluid in the abdominal cavity. You develop jaundice because you can't break down or excrete the bilirubin. And those are the signs and symptoms. You also have bleeding tendencies, infection tendencies, like I mentioned earlier. And of course, dyspepsia, abnormal acidity, esophageal varices, a whole host of issues. And so these patients need appropriate diet. They could develop things like hepatic encephalopathy, where the ammonia levels of protein breakdown are not being broken down and excreted because the liver is not working. And that causes an altered level of consciousness, asterexis, the flapping hand tremor, and a whole host of other issues.